friends, today I will explain you about semen analysis. First of all, I will tell you what male infertility is. Male infertility is the male's inability to cause a pregnancy after having regular intercourse with a fertile female without birth control for 1 year. About 85% of male and female couples will be able to get pregnant within 12 months of trying. First of all, we will understand the basic anatomy, how sperm is formed, and which glands are present and important for the secretion. Firstly, the testes. The testes is important because it is in the seminiferous tubules. Spermatogenesis occurs where sperms are formed. From there, the sperm moves through the tube-like structure known as vas deferens. Two glands are present: seminal vesicle and prostate gland. These both glands are important as far as semen is concerned because seminal vesicles mainly secretes fructose and prostaglandin. Fructose provides energy to the sperm, and the prostaglandins, which is secreted by seminal vesicles, it increases the contractility of female genital parts so that sperm's motility improves in that condition. Second is the prostate. What does prostate do? The prostate secretes the zinc, and the most important is the prostatic enzymes, which liquefies the semen, which means when semen is ejaculated out from the urethra, it is very thick. It appears approx 20 minutes to get liquefied, which is known as liquefaction time. So that the most important factor which liquefies the semen is prostatic enzyme. In some cases, if semen don't gets liquefied, that definitely the secretion in his prostatic enzyme is less, or there might be a blockage. So the question arises why. The anatomical importance for semen analysis is important. I will give you an example. Suppose there is a normal patient whose testis volume is normal, but in his semen sperms are not present. Then definitely, if this testis volume is normal, means spermatogenesis is occurring. Sperms are also forming, but that those sperms not carry forwarding in the next stage. In this condition, there might be a blockage in the vas deferens. Seminal deferens, or in the prostate, means the prostatic blockage. So this is how the final secretion of seminal vesicles and prostate, and the final secretion is being ejaculated out from the urethra. This was the basic anatomical knowledge which is important to know about the semen analysis. Now I will explain you about the specimen collection. How the specimen collection is being done. In specimen collection, the most important instruction given is the abstinence time. What abstinence time or period is? It is a time in which couple don't perform any sexual activity or masturbation. Normally there should be 2 to 5 days of abstinence. Why there should be 2 to 5 days of abstinence? Because if couple has done sexual activity before 2 days and then they are coming for the semen analysis, that then definitely the sperm count will be less. Like this only if the abstinence period is of 1 week without doing sexual activity or masturbation, and then they are coming to for the semen analysis, then sperm count will be high. So there is much difference in these two conditions. So that's why the ideal time is of at least 3 days, which is maintained in the report that how much abstinence period. Other things are that the specimen collection container should be clean, sterile plastic container having a wide opening. If the sample is collected at a home, then it should be delivered within 1 hour of collection. The liquefaction time is within 30 to 60 minutes after collection. After 30 to 20 minutes of liquefaction, if the sample don't liquefy, then in that condition, as I told you that the prostatic secretion is most important for semen to get liquefied. If semen is not getting liquefied after also 20 minutes, according to the WHO criteria, and in some labs 30 minutes is considered. Yeah, if after 20 minutes also the semen don't get liquefied, then in that condition there is a problem in this prostatic secretion. Now firstly we will discuss about microscopic examination. Microscopic examination, in this, we see the appearance of the semen. Generally, the color of normal semen is grayish white color and is translucent. If you see turbidity, यानी कि sample में अगर थोड़ा सा भी धुंधलापन दिखता है, definitely in that sample the percentage of WBC is more, that is the person is having an infection. If the sample is yellowish in color, in that condition, if patient is contaminated with urine as urine contamination. And the other is the abstinence period. If the abstinence period is more than 1 week, in that condition also the semen sample is yellowish in color. Or if the patient is taking any medicine, in that condition also the semen sample seems to be yellowish in color. This was the basic about the appearance of the semen. Now the next is volume. Generally the volume should be 1.5 to 5 ml. If sample is less than 1.5 ml, then that means seminal vesicles are not making enough fluid or are blocked, or the patient is having a problem with his prostate. Why it happens? Because the testes produce the sperms, but the volume, the enzymes, proteins are secreted by the two glands, which either are the seminal vesicle or the prostate. Second is the pH. pH is ideally normal between 7.1 to 8. If the pH level is low, it means the semen is acidic. Whereas if the pH level is high, it means the semen is alkaline. If the semen is acidic or alkaline, in that condition, the motility of the sperm decreases. The seminal vesicle performs basic secretion, means by this semen becomes alkaline, whereas the prostate forms acidic secretion, means by this semen becomes acidic. In these two conditions, if any of the secretion is more than the pH, then pH will be changed. The pH is measured by the pH meter or by the pH paper, or if both are not present, then by using urine strip pH paper also the pH of the semen can be measured. Next is the fructose level. What is fructose? If there is no sperm present in semen, the patient will probably checked if for semen fructose which is produced by seminal vesicle. We know that fructose is being secreted by seminal vesicle and to provide energy to the sperm. In cases if the blockage is in seminal vesicles, then the fructose level will also be less because there is no sperm present in the sperm count is decreasing. And the fructose level is also decreasing, then definitely there is a blockage in the seminal vesicle. For counting, Mackler's chamber is used. In this Mackler chamber, 10 rows and 10 columns are present. We have to count either the 10 rows or 10 columns in the image, and after counting the total number of sperms, this will be counted in million per ml. Now there are basic terminologies used for semen analysis. First is normozoospermia. What is normozoospermia? Normozoospermia refers to that all the semen parameters are normal. Means the size, shape, morphology, motility, everything is normal. Oligozoospermia is a reduced sperm number. Third one is the asthenozoospermia, in which the sperm motility is less. Fourth, teratozoospermia, in this the increased abnormal forms of sperm. The fifth one is oligoasthenoteratozoospermia. In this, the sperm variables are all subnormal. Azoospermia means no sperm is semen, no sperm in the semen present. For this, the fructose test is done. Aspermia means no ejaculation failure. Leukocytospermia means the increased white cells in the semen. Necrozoospermia, all sperm are non-viable or non-motile. After counting, you have to count motility. What is motility? The presence of sperm capable of forward progressive movement is critical for fertility because once presented to the cervix, the sperm must propel themselves through the cervical mucosa to the uterus, fallopian tubes and ovum. Motility should be evaluated within 1 hour of sample collection. To evaluate sperm motility, place a small drop of liquefied semen sample on a slide and then cover slip it. Now observe the motility of the spermatozoa for dx out of 100. Normally more than 60% or equal to 60% sperm should be motile. The result is expressed as percentage. Asthenozoospermia is a medical term used for reduced sperm motility. The motility is divided in 4 categories. If the motility count is less than 50%, then for the other 50% we have to do vitality test for checking whether the 50% of sperms are dead or live. In that, in 1 ml of semen we have to put 1 drop of eosin and nigrosin. General principle of this concept is that the cell membrane will not take up the eosin or any stain, and then they will be transparent, means the sperms are alive, whereas the dead sperm will have damaged cell membrane, so that they will consume the stain and they will be dark. The third one is sperm morphology. The morphology shows the shape of the sperm. The morphology should not be abnormal. For slight preparation of sperm morphology, a smear is prepared by spreading a drop of semen on the glass slide. Then it is stained by whether Papilikov stain, short stain, or by diffuse rapid stain. And then the percentage of normal and abnormal spermatozoa are counted. 100 spermatozoa should be counted under oil immersion. Normal sperms consist of head, neck, and tail. A normal spermatozoa has a flattened oval head and an elongated tail. Tetrazoospermia is a condition which is characterized by the presence of sperm without abnormal morphology that affects fertility in males. So, what are the causes of abnormal morphology? Infection, higher fever, organic solvents. Like if a person is working in a chemical factory, in that condition the sperm morphology also affects the person. Using illegal drugs, taking excessive amount of alcohol, congenital testicular abnormalities, varicocele. Varicocele is an important factor. It is a disease in which the pampiniform vessels of testes are dilated, due to which the morphology becomes abnormal, and the last cause is due to smoking. The sperm's normal head length is 5 to 6 micrometer. The diameter should be 2.5 to 3.5 micrometer. Acrosome must contribute 40 to 60% of the sperm head. The midpiece must be slender, axially attached, 1.5 micrometer in head length. No cytoplasmic droplets should be present. In tail, the tail should be straight plus single unbroken. On sperm head, acrosome is present. The function of acrosome is to help the sperm get through the egg's protective coat and to allow the plasma membrane of the sperm and egg to fuse. This places both haploid nuclei, one from the sperm and the other from the egg, one from the egg, into the semen cell. They form the diploid genome of the new organism. The acrosome contains digestive enzymes including hyaluronidase and acrosin. These enzymes break down the outer membrane of the ovum called the zona pellucida, allowing the haploid nucleus in the sperm cell to join with the haploid nucleus in the ovum. The next is midpiece. Midpiece is packed with mitochondria to release energy needed to swim and fertilize an egg. The third one is the tail. Tail enables the sperm to swim.